All right, we're first going to talk about the paramyxoviruses. Again, large group of viruses here. These are helical viruses, and remember, there are no naked helical viruses, so these are all enveloped. And we're going to talk mostly about measles, mumps, paramyxo, or parainfluenza virus, and respiratory syncytial virus. And we'll talk briefly about human metapneumonia virus. Okay? Measles is high yield, very clinically relevant topic for USMLE Step 1. Even though, again, we vaccinate, we still see infections with measles in the U.S. This one you got to be able to pick up, okay? Remember, it is similar as far as the rash to German measles. So here's an image of measles. Looked very similar to the one I showed you of German measles. So just by looking at the rash, you would have a really hard time distinguishing between German measles and measles, okay? So here again, we're talking of a respiratory infection and what happens with the virus, because this family, just like herpes viruses, have a fusion protein. One of the things we're going to see are cell-cell fusion, or syncytia, or giant multinucleated cells. So we're going to look out for those. Now, measles is one of those classic diseases. Like, if you miss this, you really need to slap yourself around a little bit, all right? Because it's classic presentation. It's going to start with what we call the 3 C's: cough, coryza, conjunctivitis, and then we'll throw in a P. And it doesn't have a C, so we're going to call it a P. It's the 3 C's and photophobia, all right? So then you're going to develop the Koplik spots. Koplik spots look like little grains of sand surrounded by a little erythema in the buccal mucosa, okay? And that is going to precede the outbreak of the rash, okay? So you're starting with the maculopapular rash from where? From the ears down. Where does rubella start? On the tip of the forehead and works its way down, all right? Now, measles can also cause giant cell pneumonia. Remember, I said that was a complication as well with VZV, and it goes back to the fusion protein. So if you see giant cells, giant multinucleated cells, the pathological term for those here are Warthin-Finkeldy cells, okay? So measles, we have 3 C's with photophobia, we have Koplik spots, and we have the rash. And remember, you're much sicker with measles than you are with German measles. Now, remember, very beginning of this chapter, we talked about an acute infection with a late rare complication, and that is what we're going to talk about here. Subacute sclerosing panencephalitis. Remember, this was like a defective virus that slowly causes degeneration of the CNS. So it's like the Terminator. Remember, you beat it up, you knock it down, but it's still got a little bit left. It's probably what you feel like all this studying, right? You just feel like you've been beat down, but there's still a little bit left. And what happens here is this defective virus is going to start deteriorating the CNS. So 10 years later, after your primary infection with the measles, you start getting some symptoms like behavioral changes, intellectual changes. You may have gait disturbances. And unfortunately, the majority of the time, SSPE is usually fatal. Again, it's extremely rare, okay? Extremely rare. Here is a nice image of the Koplik spots. Remember, I told you they looked like little grains of sand in the buccal mucosa surrounded by this area of erythema. That is very likely to show up as an image. They can tell you that somebody comes in with a cough, a runny nose, conjunctivitis. They may or may not be sensitive to light. They have this weird kind of rash on the inside of their mouth. So you have to be able to identify Koplik spots. Diagnosis is typically made on clinical grounds. You can do serology. And treatment for measles is mostly supportive. And I'm telling you, you feel really lousy when you have the measles, all right? They are toying around with ribavirin. They currently use ribavirin as the drug of choice for respiratory syncytial virus, which is also in this family. So it's showing some promise as a treatment for measles and some of the other viruses that we've talked about, like SARS, for example. You also have to know that measles is covered by the MMR vaccine, all right, the measles, mumps, rubella, which is a live viral vaccine that we use in this country, and we try to vaccinate as many kids as we can. It's a requirement, again, to get into our public school system here in the U.S. Another important virus in this family is mumps virus. Mumps virus is also a respiratory pathogen, and so it's transmitted again through respiratory droplets, and it causes a lytic infection. Now, what is classic for mumps that everybody's seen, probably at one point or another, an image of somebody with bilateral parotitis. So you get major swollen parotid glands. It can be unilateral, but most often it's bilateral. Now, the money question they love, love, love to ask about mumps is they'll tell you that it was a male that was infected, and they'll want to know what the most serious complication of that is, which is orchitis, which can lead to sterility. Okay, so you definitely want to know orchitis, which can lead to sterility in males. That is a really high yield, clinically relevant fact you need to know about mumps. It is also associated with viral meningoencephalitis. Okay, so that can be also a really horrible complication of mumps. Not usually one they ask you about. They usually ask you about the orchitis. Here is an image of mumps. This is the one you've probably seen in like every textbook under the sun, where you just see the major swelling there of the parotid gland. Okay, and again, most often it's bilateral. Occasionally it can be unilateral. Very, very nasty disease. People that actually know that had this disease, so before the vaccine came out, remember having mumps and how extremely painful it was to move their neck because of all that swelling. And then on top of that, they had kind of like the flu-like illness with the fever. Very difficult to swallow. So we're very glad that we now don't see very many cases of this in the U.S. Although in 2006, remember we saw that strange epidemic in the middle of the country where a lot of college students were getting mumps. And there were several thousand people that actually came down with mumps in that one particular outbreak, which was very interesting. How are you going to diagnose mumps? Usually that's on clinical diagnosis, although you can specifically do it again with serology. Treatment is mostly supportive, and this is the last of the viruses covered in the MMR vaccine. So we have measles, mumps, and rubella, and they are all three live attenuated. All right, some of the other paramyxoviruses we're going to talk about. Parainfluenza is a cause of croup. Croup in children is extremely common. My daughter gets this so frequently she diagnoses herself. So this is what she does. She'll be coughing all night, and it's that characteristic seal barking cough. And she'll wake up and she'll say, "Mommy, I have the seal bark cough again." Yeah, we usually know that because she's been keeping us up all night with that barking cough as well. Very, very common, causes tracheitis. Mostly it is self-limiting. Sometimes if it gets really inflamed, you can give steroids to control the inflammation, but again, most of the time that's self-limiting. If adults were to get parainfluenza virus, they will typically get a common cold. Now, very similarly, respiratory syncytial virus has a specific disease in infants and children in that it causes bronchiolitis and pneumonia. So again, if you have viral pneumonia in an infant, especially a preemie, the first thing you're probably going to think about should be RSV. If adults get RSV, it's typically going to manifest as the common cold. Now, we do have treatment for RSV, and that's ribavirin, what we're using now to try to treat some of these other RNA viral infections. You can also use anti-RSV antibodies, so for passive immunization. Now, again, although fairly low yield, just something I want you to be aware of, Metapneumonia viruses have actually been shown to be responsible for 15% of the common cold in kids and can progress on to bronchiolitis and pneumonia. So if you see these viruses on step 1, you don't want to be like, I've never heard of those before. Okay? You'll want to know that metapneumonia virus in children is a fairly common cause of the cold, in addition to what? Rhinoviruses and coronaviruses. Okay?